Welcome back to The Wellness Effect. Now that you've found our channel, there's only two things left to do. Subscribe and hit that notification button. You'll be sure to never miss out on our informative interviews with the experts. Dr. Daniel Brozin has joined me in studio today to help us find out how one can keep fit and healthy in their retirement years. Welcome, Dr. Brozin.
Thanks for having me.
What is geriatric medicine?
So geriatric medicine it's in essence care of the elderly. So what we do is we look at more complex medical problems for patients generally over the age of 65. So our services are, ranging from, the sort of mental health side of it, and it's a discipline of internal medicine. So we're looking at guys with multiple different diseases and how they sort of act together in the older person.
And why is maintaining great physical health in your retirement years important?
So the thing is, the retirement years are quite a difficult time in general, both from a physical and a mental point of view. So what we know is if you can maintain quite a good physical, a good level of physical activity, you can stave off a lot of the problems that we encounter during your retirement or, geriatric years. And it's generally not a huge amount of physical activity that you have to maintain to keep fit. But it's an often overlooked thing, as you're getting older, is to actually make sure that both your mind and your body maintain an adequate level of fitness.
What are some of the common health issues that retirees face, and how can they be addressed?
What we see is, as you're getting older, the general age of retirement in South Africa is about 65. And what we see at that sort of time is guys with chronic conditions where it's starting to come to the fore. Things like high blood pressure, diabetes, high cholesterol. What we deal with a lot are things like falling, so lots of multiple falls. Then it's also a lot of the more nuanced mental issues. So things like, as you're getting older, we have to deal with things like, dementia and things like depression. And these are the more common things that we deal with.
And how often should retirees schedule regular health assessments?
So what we do generally is that if you're relatively healthy, then once a year is generally fine. Whereas if you have a more complex sort of medical issue that needs to be checked up on, at sort of more regular intervals, generally about every 6 months.
And what specific tests and screenings are crucial at this stage of a retiree's life?
What we do is, you often divide it, males and females. So in the sort of the male population, what we look at are things like cancer screening tests. So things like checking for prostate cancer. So we have blood tests for that. Things like checking for colon cancer. So we have what we call screening colonoscopies. In our female population, things like mammograms, checking for breast cancer. And then, throughout our populations are testing for, our cognitive disorders. So what we do is we can provide a sort of baseline cognitive function to see whether or not someone is, has any kind of neurocognitive decline that we can address.
And what sort of preventative health measures should retirees prioritize?
What we look to do is we try to get guys to address their underlying medical problems. So, for example, if you have a high sugar, you have diabetes, is to maintain, a relative, a good diet and maintain your exercise. We also, if you have high blood pressure, make sure your blood pressure is under control. If you have high cholesterol, making sure you're on the correct treatment regime for that. We also recommend things like a Mediterranean diet. We recommend brain-enriching activities, so keep doing what you love doing, not necessarily the crosswords or the Sudokus, but whatever you like to do. We also, really encourage social connections. So maintaining that interpersonal relationship, because we know this part of your life can often be very isolating. Also, things like you need to check your hearing, you need to check your vision, making sure all of your different senses are working optimally, because a lot of the time, this is where we start to lose our hearing and lose our vision, and that can be very socially isolating in and of itself. So it's that kind of proactive behavior, that we recommend to sort of aid in the aging process and to sort of defer any kind of complications much further down the road.
So, what sort of myths and misconceptions do you regularly hear from your patients?
Yeah, one of the big things that we see is that people don't truly understand how important your physical health is to protect your mental health,
Hmm.
right? And I'm not only saying mental health is in sort of anxiety and depression, but our neurocognitive things like dementia. So the latest sort of evidence is about 45% of of dementia is actually related to things that you can adjust. So a lot of people don't realize how stopping smoking, avoiding excessive alcohol, um, checking your hearing, physical exercise, making sure that your blood sugar is normal, how those things can stave off problems like dementia. We have a lot of the times guys will just sort of come to us and be, sort of under the impression that their mom had dementia, their dad had dementia, so they're going to get it too. But that's not always true, And another thing that we see a lot is that, um, when the older patients come to us that, they don't have much reserve, they don't have much, they don't have what we call reserve is like the ability to sort of function well in society because, you're getting older, you're getting sicker. And that's not necessarily true. If you can look after your body and look after your mind and making sure that, you're proactive, you can actually live a very, it's not necessarily about how many years you're living, but it's the joy that you're getting in those years that you're living.
Thank you, Doctor, for such an engaging conversation. I took a lot out of it, and I'm sure our viewers are going to take a lot as well.
Thanks so much for having me.
Thank you for watching. You can access all previous and upcoming episodes of The Wellness Effect here, so make sure you subscribe and hit that notification bell. See you next time. Bankmed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by Bankmed, yours in good health.